Good afternoon, everyone, and thank you for coming to the presentation for understanding high deductible health plans. Oops, I'm sorry. Oops, I gotta go back. Not going back. My name is Linnell Fry. I am the program specialist in outreach and program services with the Healthcare and Insurance Department at OPM. Along with me, I have Amber Rhodes, who is the supervisory analyst with the same group, Outreach and Program Services in Healthcare Insurance. And today we're going to talk to you about high deductible health plans. What we'll do is give you an overview of the high deductible health plans, the health savings account, the authority that it comes from, there's the eligibility, and also the features. And then also we'll talk about the Health Reimbursement Arrangements, HRAs, and their features. But first, I would like to go over a few housekeeping things. Please be reminded that all lines will be muted during the presentation. If you do have questions, please feel free to use the live Q&A that we have, and we will address them as they come in. Also, just to let you know that class materials will be found in the registration portal, including slides and the recording of the class. The recording will be available at the end of the training event in September. Other than that, you may send questions to benefits@opm.gov. Okay, we're going to try this one more time with me doing the slide presentation. Oh, it's working now. Okay. Now, as you know, a high deductible health plan, which is a HDHP, is an insurance coverage plan. The service delivery for the HDHPs offers the same as our regular FEHB program carriers, which is PPOs, preferred provider organizations, HMOs, health maintenance organizations, or point of service, POS. Depending on the HDHP, the enrollee may have the choice of using in-network or out-of-network providers. We all know that in-work providers will give them the best bet on their money because it will save from extra costs. While the HDHPs have higher annual deductibles and out-of-pocket maximums limits other than the FEHB program plans, HDHPs have additional benefits that allow enrollees to save and manage their money. Like traditional health plans, in-network preventive services are covered in full. With an HDHP, the annual deductible must be met before plan benefits are paid. HDHPs also protect against catastrophic out-of-pocket expenses for covered services. Once annual out-of-pocket services have been met, then the plan pays 100% of the allowable amount for the remainder of the calendar year. And those things that need to be met are things such as the deductibles, the co-payments, and the co-insurance. And they must reach that predetermined catastrophic limit. Now, let's talk about some of the advantages. These health plans have these HSAs with them, and they help with tax purposes. They earn tax-free interest, and the enrollee can make tax-free withdrawals from accumulated funds to pay for qualified out-of-pocket expenses, including their annual deductibles. For some reasons, the enrollees that are not eligible for HSAs, woo, these little acronyms are getting me. The plan will simply provide a health reimbursement arrangement, or HRA, instead. The HRA is a medical fund for a designated amount that is available upfront. Now, this is the basics of our high deductible health plan. Part one is that we have the plan, which is the insurance coverage that is intended to cover serious illnesses or injuries. Now, the other benefits, as we discussed a little bit of, was the health savings account and the health reimbursement arrangement. Those are dollars for the healthcare expenses on the health savings account side and credits for the healthcare expenses on the health reimbursement arrangement side. So let's do a little bit of breakdown for the health savings account. Okay, so the account is set up and funded by the plan through the premium pass-through. You, as the employing office, will not have to do anything with that. The plan takes care of it all. All you need to do is make sure that if you want to offer automatic payroll deduction so the employee can just have it come out, then that would be the most that you would have to do. The HSA allows tax-free withdrawals, as I said, for qualified medical expenses. A few examples of those medical expenses are out-of-pocket costs, including deductibles, co-insurance and co-payments, prescription drugs, eye exams, dental treatment such as fillings, braces, and extractions. The account does earn interest, tax-free, and any unused balance carries over from year to year without penalty. The account is owned by the employee and is his or hers to keep, even if they retire or change plans. It is real money and it belongs to the account holder. The enrollee's HSA may be funded up to the current IRS limits through the premium pass-through, the monthly contribution, which is from the health plan. And if they wish to save on their taxes, the enrollee may make their own voluntary contributions, and that is for the HSAs. The voluntary contribution is made directly to an IRS-approved trustee administering the HSA. So basically, plan money plus members' own contribution, which is money, and interest earned equals your HSA. Pre-tax allotments can be made through their HSA through the Federal Flexible Benefits Plan. The enrollee does not pay taxes on the money that the plan puts into their health savings account. And their own health savings account contribution is deductible on the income tax return or pre-tax if it's made through a payroll deduction up to the IRS limits. Annual contributions may be made at any time during the calendar year up to April 15th of the following year. Now, just understanding the authority. This comes from Section 223 of the Internal Revenue Service Code. It provides individuals covered by these plans tax-preferred treatment of money saved for medical expenses. Now, as for the IRS rules, they must be enrolled in an HDHP, not covered under any non-HDHP plan, not enrolled in Medicare, not claimed as a dependent on someone else's taxes, and not received VA or IHS benefits in the past 3 months. And they should be enrolled in a general healthcare flexible spending account or covered by the spouse's FSA. However, a limited FSA or Lex SFA that covers only dental or vision is not permitted. This HDHP helps him or her determine their eligibility for an HSA. If they do not qualify for an HSA, the HDHP will establish a Health Reimbursement Arrangement, or HRA, for the enrollee. Once the enrollee has an HSA, if they later become ineligible, no additional funds can be added to the account from either the HDHP through premium pass-through or individual contribution. Money in the account can still earn interest, tax-free, and tax-free withdrawals can be made for qualified medical expenses. Unused funds will carry over from year to year. Now, here are the features of an well, let me first ask if anyone has any questions that we need to address before we go ahead. Amber, do you see any?
I've been answering questions.
Oh, okay. Okay. Thank you. Okay. The features of a health savings account. Annual contributions. Well, first of all, basically, this is how it works. The health plan deposits a premium pass-through, and then the enrollee can make voluntary contributions. There's no tax on the premium pass-through. Voluntary contributions are recorded on their tax form, such as the 1040, as a tax deduction, and applies with either itemized or standard deductions. These two contributions can earn tax-free interest. This money can be used for qualified medical expenses, as I mentioned before. The money can also be used for non-medical expenses, but the enrollee has to pay regular tax and a 20% tax penalty if they are younger than 65. Tax-deductible contributions, his or her own HSA contribution, the enrollee's own HSA contributions are either tax-deductible or pre-tax if made by payroll deduction. Annual contributions may be made anytime during the calendar year up to April 15th, as mentioned before, and the plan's premium pass-through is not taxable. The annual maximum contribution is established by law. In addition to maximum contribution, the plan's annual, which is the plan's annual deductible, individuals between the ages of 55 and 65 can make a catch-up contribution to the HSA each year. But you would have to definitely look at the IRS limits annually to see what that amount would be. You recall that the HDHP helps determine eligibility. If an enrollee is not eligible for HSA, the health plan will enroll them in an HRA automatically. Neither the agency nor the enrollee has any stake in that. That is strictly done at the plan level. It's important to know that an HRA is a virtual account with credits held by the health plan. It's not an actual bank account owned by the enrollee. If the enrollee moves to a different plan, they will forfeit any dollars accumulated in their HRA. And that's an important factor that the enrollees need to understand between the two accounts. That in the HRAs, they can be forfeited by changing plans, whereas the HSAs, you don't have that problem. Now, the features of a health reimbursement account. This is how an HRA works. The health plan makes credits to the HRA. These credits are not taxable, and the enrollee can make tax-free distributions from their HRA for qualified medical expenses. Now, let's just do an example of an enrollment setup, contribution, and distribution process. Okay, so here's the steps when a person elects to enroll in an HDHP health plan. During open season, the enrollee submits their SF-2809 choosing an HDHP. The ABO receives it, a hard copy or electronic, and processes the 2809. Then they update the system with the enrollee's choice of plan. When the enrollee signs up for the HDHP, the plan provides the documents to establish a health savings account, either via mail or online. The first premium pass-through is deposited to the HSA or credited to the HRA by the plan. The enrollee completes the trustee custodian paperwork and sends it to the health plan. In case of an HSA, the plan cannot fund the first contribution until the enrollee has opened the account. The plan sends over the card to the enrollee, which is usually received in January or February, for elections made during the open season window. I thought that I would show a chart of the benefits between the two different accounts. So with the HRA, again, it draws interest, and yes, the interest comes from when either the HRA started with the pass-through and also interest with the amount that the employee can put in. For the HRA, it does not earn interest. Tax-deductible contributions to your account. The enrollee can make deposits, and for the HRA, enrollee cannot make deposits. For withdrawals of funds for non-medical purposes, that is true for the HSA subject to tax and penalties prior to age 65, but with HRH, it is not available. The portability is for HSAs, yes. You own the account, it can travel with you from plan to plan. But with the HRAs, no, your account is forfeited if you leave the sponsoring plan or leave the government, except for retirement. So this gives a brief overview of how the HDHPs and HPs, the HDHPs, the HSAs, and the HRAs work hand in hand, and the things that you might have to do on your end, which basically is just completing the enrollee process of the 2809, and then everything else is pretty much taken care of through the actual plan. But if you need more information, because we have more detailed information on our website at www.opm.gov, ensure Health HSA Index ASP. So right now, I would like to turn it over to any questions that we might still have, Amber.
Yes, so I'm still answering questions in the chat. Can everyone hear me okay? Linnell, can you hear me okay?
Yes, I can hear you. I'm sorry.
Okay.
Yes, they can't respond.
Oh, no, that's fine. So they have one question says, my question was not about qualified medical expenses. I guess the question is, as I tried to summarize, is what is a qualified medical expense? So that would be based on IRS rules, and I'll share that with the entire group, and based on the benefits specified in the plan that you choose, and that would be in your brochure, which is your official statement of benefits. So the next question is, how does the plan determine if the employee is going to have an HRA versus an HSA? So the health savings account, you would need to meet the qualifications for that to be eligible, meaning not having to use IHS benefits or VA benefits within the last 3 months. You have to be enrolled in the HDHP. So let's say, for example, you did have a person who did receive IHS or VA benefits in the last 3 months. They would be ineligible for the HSA. Therefore, the plan would then provide them the opportunity to have an HRA, a Health Reimbursement Arrangement, in which you are eligible if you have received benefits from another group health plan. I did post those rules in the published chat, so take a look there and hopefully that answers the question for that one. I think we got several questions on that. Can you clarify about the calendar year plus the April 15th of the following year so the calendar year, the health plans run on calendar year from January 1 to December 31st. And then you would have up until April 15th to use those use your HRA for HSA for the year prior. So it's kind of just an extra time frame to allow you to get those things processed. What is premium pass-through? Premium pass-through is the process in which when you make your premium payment, a portion for an HSA, a portion of your premium goes to your health savings account, and so we use the term premium pass-through to identify that process. Okay, Lynell, I think that we have covered it. If you want to take a look and see if there's anything else you want to address.
Yeah, because I was just looking through. Because yeah, I guess the HDHPs are kind of hard to explain to enrollees, but it's kind of like an open and shut case.
Right.
So, and especially since they aren't technically governed like what we have with FEHB, their rules fall under IRS. So we kind of like adapt to whatever they put out.
Right.
So I don't know if anyone has anything else, because
I think we have one more question.
yeah, see.
So I think the question is it to be used for not otherwise reimbursed medical expenses, or can it be used without tax penalty for all medical expenses, including expenses that have otherwise been reimbursed? So it will not be able to be used for things that have already been processed if you didn't have the HDHP, right? So you would need to be an HDHP and have made those benefits during the time that you were enrolled in an HDHP. You are eligible to make, pre-tax allotments to your HSA through your payroll office. You can your own voluntary HSA contributions are either tax deductible or pre-tax, if made by your payroll deduction. It is kind of your bank account, so you can use it. You're not required to contribute to it individually, but there may be a minimum balance required to maintain your HSA. So that would be between you and your HSA provider. And I'll put in the group some frequently asked questions that we all find helpful to use when explaining information to employees. Let me provide some more context to HDHPs. I'll also share another resource, which is our fast facts on HDHPs. I'll share that as well for everyone to take a look. If we haven't gotten to everybody's question today, we will be continuing to try to address all of them via the chat. So please just be patient with us. We appreciate it. Okay, I'm gonna kick it back over to Linnell.
Okay, I was just looking at a question, and I couldn't tell if you had answered.
Oh, go ahead.
No, I was saying I can't tell if I couldn't tell if you had answered it because another person, I guess you had answered the first question, said, "Hello, moderator. My question was not about what are qualified expenses. It was, is it to be used for not otherwise reimbursed?" Is that what you just read?
Correct.
Okay. So I was just gonna dismiss that one then, so I could see something else.
Yep.
He has an existing SA.
Just sharing some additional resources for the group.
Okay.
And the resources that I'm sharing, it looks like we have a couple common themes of questions. So I'm putting them in the published area for everyone. So I think we have one now. How do you increase or make a voluntary contribution to your HSA? So to make a voluntary contribution, once you sign up for an HDHP, you'll need to set up your HSA separately in addition to that. So when you enroll in the HDHP, there's still an extra step. And I think we did get the question, what are the most common mistakes that we see when people are selecting HSAs? And I think sometimes it could be that extra step to set up after you sign up for the HDHP, to set up your HSA. So you would need to contact the provider of the HSA in order to have instructions on how to make a voluntary contribution to your account.
Yeah, I think that addresses another one that I was looking at.
Okay. Okay.
Oh, well, that's probably in the FAQs because it says, what's the biggest benefit for HDHPs? It's I guess it comes with that account that has the tax savings.
Right. So the benefit there is you're able to save. There's obviously the tax saving, and you're able to save for expenses. So there's a higher deductible, yes, but you're able to, let's say you have a large expense coming in the future, you're able to allow those that premium pass through, the money that's going through your premium pass through, the opportunity to accumulate. So then you'll have that money to pay for that expense or any other expenses that you occur, that you can use that account to pay for.
Okay. All right. I don't see any. Do you see any newer ones, Amber?
I do not. Going through. Thank you, everyone, for your patience.
I don't know if you saw those because a couple of people are asking what are the, I think, did you cover the IHS benefits?
I did.
Okay. I know, I was reading while you were talking.
No worries.
Okay.
So we do have a new question. Is the provider the insurance company like Aetna? So when you sign up for a health plan who offers an HDHP, your health savings account will be through a financial institution. So in order to make contributions or to set that up, the financial institution would have that information. You cannot use your HSA money to pay yourself again for otherwise reimbursed qualified medical expenses. That would be a no. Yes, flexible spending accounts are different from health savings accounts. That is correct. I did put in the Q&A, the published Q&A, a chart that goes over some of the differences, and I'll also provide a link to some more information about flexible spending accounts, as yes, they are different.
Okay.
Why do the financial institutions always refer employees back to the agency HR instead of the FEHB provider that the HSA is attached to? Does OPM have any training for FEHB, HDHPs to make better partnerships with the financial institutions? I don't know why they do that, but we'll definitely take that note back to see what relationship they have, and if they don't have one, to maybe cultivate those relationships or make those relationships stronger.
Okay.
I do see the question on how long do people have to make to contact their financial institution to set up their HDHP. If you're making an open season change, theoretically, you would think that they would want that set up prior to the effective date when their first premium will pull. So, I would say before then. And if you look, if you want to, I would strongly suggest that you send for employees that do sign up for HDHPs and maybe having trouble signing up for their HSAs. Many plans have, it's automatic. So, you know, to minimize that misstep. But in their health plan brochure, it will give them exactly, there's a section called General Features of our HDHP plan or HDHP, and it will tell them, you know, how the plan works and what's provided, along with their, you know, of course, their official statement of benefits. But in the beginning of the brochure, in section 1, it's how this plan works, and that is a good reference point to point people to if they need more information on how their plan works. It provides information about the HSA, how much will be deposited a month for self-only, self+1, and self and family. Provides them information on how to, and the contributions if they want to make their voluntary contributions to their HSA. Provides some information, that other information they want to consider, their deductible information, and more specific information about the HSA and the HRAs. So I think, and also some information about the catastrophic protection for their HDHP. So I would say point people not only to their financial institution, but to their brochure. Nice. Okay, Lynell, anything else that you see?
Well, somebody responded back, I guess, for clarification regarding about the VA benefits. And I believe we're talking just the medical benefits, that because they're mentioning about education assistance, those wouldn't qualify, correct?
What it states is that a person who has received healthcare benefits within the past 3 months would not be eligible for the HSA. Therefore, they would qualify for the HRA.
Right. Okay. So I just wanted to just make sure they understood that we're talking healthcare benefits, not any other VA benefits.
Correct.
Okay. So I think that we have pretty much answered most of the questions.
Yeah, I see there's one question about allotments and a payroll provider. That is not a process that we are involved in, but if you want to contact us after, perhaps we can assist getting you to the correct office that may be able to assist you with that matter.
Okay. I don't see anything else new come in, even though they're moving fast.
I know.
But as Amber said, you know, we will look at the chat still and answer any questions that we have not addressed if we can, or at least direct you in the way in which you should possibly get that correct answer. So at this time, I am done with my presentation. And again, if you, the first line for enrollees is if they have any questions, they should reach out to the plan that does the HDHP. If they have any questions regarding setting up allotments, that is done through you all, through the agency. And any other general questions, they are always welcome to visit our website at OPM to get more information on HDHPs. So this concludes my presentation, and I hope you all have a wonderful day and enjoy the rest of your week. Thank you.